Councillor Mason, you have up to 5 minutes. Thank you.
Thank you, Mr. Mayor. What happens to the economy of the borough, especially in these ongoing COVID pandemic times, is an important consideration. Even if the Brompton Trust, which of course say they have no duty to do this, or certainly the government, do not think so. There's no joined up thinking here. And when we talk about land values, for example, the 1 billion property values, this sort of action is going to rocket up property prices and lease prices all over Chelsea and all over London, which actually hits scores of small businesses. And that is something that they complain about day after year after month. Now, the Royal Brompton and Harefield Hospital Foundation Trust, they've been working for years, it appears, to leave the borough and to merge with the other trust guys. And for those residents who expect a consultation, as Councillor Nalgi and Larry has said in particular, and Councillor Healy, no consultation required, thank you very much. No consultation required, and we should have that consultation. And I agree, we need to have an inquiry. Now, remember, the planning and property aspects being discussed in public realm scrutiny, which I sat on before 2010. So this battle's been raging, as councillors have said, for probably 10 years. And as we say, it's not just because it is the preeminent specialist centre for heart and lung disease, and children's services in the UK has already been quoted, but because, as we say, losing Brompton the Brompton Hospital is likely to have a severe economic impact on Chelsea and no doubt the borough as a whole. Now, the Brompton Trust say that they are not leaving entirely because they intend to develop a heart and lung centre at St Thomas's Hospital. And this will take about 10 years. But this hospital, unless my location is wrong, is in Westminster. So we are somewhere in the middle of this COVID pandemic, where we have come out of one of the a long lockdown and are heading partially into another, given the rising infections. And there may be this may go on for another 2 years. But looking at the situation during and after the pandemic, Brompton Hospital is surely, as we say, an important economic driver, and they are generally hands-on professionals. So a substantial number, even during the pandemic, will be coming to work. Brompton Hospital employs about 3,000 medical and other staff, according to their stuff online, and they have 295 hospital beds. And if only 2 family members visit each patient weekly, that's at least 600 people arriving in the borough. It won't happen during the pandemic, but it certainly happened before and will happen after. In 2018-19, Brompton Hospital's annual report says they treated 210,000 patients in their outpatient clinics, and they treated 40,000 patients on their wards. Now, 210,000 patients, Mr. Mayor, visiting the borough is a lot of people, and some may in normal times stop somewhere in a cafe for coffee or do some shopping in a local shop or market, and they're likely to use the bus and underground to get there. It's what I do when I visit guys when my partner has cancer treatment. The 2018-19 accounts say, and it may have changed, that they had 31.7 million deficit for 2017. And I have no idea what this and other deficit figures in different years represent, looking at the overall budget of some 316 plus million. That may have changed as well. But they do have procurement and spend power in the borough we don't want to lose. NHS Foundation Trusts, as Councillor Larry and others have said, created under the first of 203 Act and superseded by the 2012 Act, they are effectively free, as has been said, of central government control. And I doubt that they feel they need to listen to our residents except to pay lip service. And certainly they haven't acted as if they care about the economy of the borough. So I think the government should order an economic assessment. This should run alongside or part of the public inquiry that has been mentioned earlier by Councillor Henderson. And we need to know why none of that has been thought about. There's only the medical side has been thought about. This is a vast organisation, and we can't afford to just let them move without thinking about what's going to happen to the small businesses. It's the same argument that's been made in the city about workers not coming into the centre of London and therefore it being deserted, etc. We've got the same issue here. When big institutions, by your leave, can just leave, and this is not a poor institution. They may say they're a poor institution. This is a private business that is using its power in property, money and medical clout to do what it actually likes, and we are just supposed to lump it. Well, we should make sure that there is an economic assessment, Mr. Mayor, for Chelsea and the borough, and they should not be allowed to move or proceed with the merger until that happens, and I hope the council will support the motion standing in my name. Thank you, Mr. Mayor.
Thank you very much.